We will look at how drugs affect the growth and development of a fetus. A fetus is connected to the mother through the placenta. Through this connection, the fetus receives nutrients, metabolic wastes, as well as toxins from the mother. If a mother uses a drug, that substance can be passed through to the fetus from this connection. A fetus goes through many stages of development. Along each stage, there are certain points of vulnerability. A substance can hinder, affect, and retard the growth of a fetus. Today we will look at alcohol, cocaine, nicotine, cannabis, and methamphetamine, and how they affect the growth and development of a fetus. Alcohol use during pregnancy. The most common result of alcohol use during pregnancy is called fetal alcohol syndrome. This is a long-term condition in which the babies are born with a certain absence of left to right brain connections. It is also the most common form of mental retardation. The most noticeable indicator of fetal alcohol syndrome are dysmorphic facial features. There are an average of 19.5 per 10,000 babies born with this condition. Common results of fetal alcohol syndrome are microcephaly. Here you see a child with a smaller head than normal, as well as this lovely picture, and hemangiomas, which are benign tumors that can appear on the child. Also, you can have the dysmorphic facial features, such as small eye openings, the thin upper lip, smooth philtrum, etc. 1 to 2 ounces of absolute alcohol carries about a 10% chance of developing this condition. However, even among chronic alcoholics, the incidence of this syndrome has a very wide range. It ranges between 6 to 50%. And this is very interesting to note that if you have alcohol when you're pregnant, this syndrome is not a done deal. The fetus is not going to be born, definitely for sure, with this condition. Something to be aware of. Diagnosing this prenatally is difficult because when the physician examines the mother before birth, the babies will appear normal. You can't really tell. When physicians ask about the mother's alcohol use, not all physicians ask, and when they do, the mothers are not always honest. And in the routine drug screen that mothers take, alcohol isn't screened for. However, new developments in biomarkers have recently come out that are working towards diagnosing this prenatally, but keep an eye open or an ear open because those aren't fully established yet. The mental effects of fetal alcohol syndrome can include easy distractibility, maladaptive behavior, microcephaly, skewed social perceptions, and mental retardation, with the average IQ being about 68. So here you can clearly see that alcohol definitely affects the growth and development of the brain. Liver abnormalities, cardiac defects, organ dysfunction, less developed fine motor skills, as well as chance of developing epilepsy are increased because of fetal alcohol syndrome. Fetal alcohol effect can also be a result of a mother using alcohol while she is pregnant. This is not all the effects of fetal alcohol syndrome. You can have just the birth defects, you could have just the neurodevelopmental disorder, or you could have a mix of both, but not as severe. And both FAS and FAE children are more aggressive in class and they're less socially competent. And here you can see fetal alcohol syndrome, usually the neurodevelopmental complications result in a less higher IQ than fetal alcohol affect children. So marijuana use during pregnancy. Because marijuana, there are multiple studies that range in severity of consequences. So for the sake of accuracy, we will cover the least extreme consequences and the highest extreme consequences to be as comprehensive as possible. So a study was done which over 7,000 women who used marijuana they were analyzed, and when other factors in the study were controlled for, there was no consistent link between prenatal marijuana exposure and birth defects or pregnancy complications. So interesting to note. Also, the Johns Hopkins University School of Hygiene and Public Health found that a child's sleep patterns can be permanently effective and that there was a decreased gestational phase. However, among white women, there was an association of low birth weight, small size for an infant, as well as preterm delivery. But among non-white women, these factors were not an issue. Interesting to note. The University of Washington also analyzed the effects of marijuana use on a child, or on a fetus, and the result was when they were born, lower birth weights, delayed commencement of breathing, poor eyesight, tremors, poor ability to adapt to the environment. The babies would also spook easily, as well as a risk of developing basically a hole in the heart is what that condition is. These results were found. Also, those within the first 6 months of life, they had a greater chance of developing respiratory conditions such as chronic wheezing, chest infections, and asthma. When these children reached toddlerhood, development or behavioral problems started being noticed, such as well as less developed motor skills, memory, verbal, and reasoning abilities. There are also two specific types of leukemia and brain tumors that a child whose mother used marijuana while he or she was inside her, that person's risk of developing these increases. So nicotine use during pregnancy. Here we see that nicotine is associated with neonatal mortality, smaller head circumference, as well as a lower birth weight. And there was a study done that compared 25 women who were exposed to secondhand smoke, so not even smoking by choice, in which the placenta cells were compared to the placenta cells of 34 women who weren't exposed to this smoke, and 158 genes were deregulated in the exposed fetuses, and these genes had to do with blood clotting, stress response, metabolism of lipids, the extracellular matrix, apoptosis, as well as placental function. And here you can see cigarette use among pregnant women as well as non-pregnant women from about 2004 to 2005. So it's interesting to note usage. Methamphetamine use during pregnancy. Linda Chang and her research team took MRIs of 29 children that were 3 and 4 years old whose mothers had used methamphetamine while they were pregnant with them, and they compared it, and she and her team compared it to 37 children who were not exposed, and the MRIs yielded results that had about 4% lower diffusion of molecules in the white matter of the brains of the exposed group. And this is why Chang proposes that this is why the group reached developmental milestones later than the control. Also, Elizabeth Sowell compared 21 children that had been exposed to both alcohol and meth, and she compared it to 13 children whose mothers only used alcohol. And in this study, she found that the children whose mothers used both alcohol and meth were more severely affected, and growth and development was significantly more hindered than simply alcohol. Cocaine use during pregnancy. Well, we'll see that in some urban areas, studies show that about 15% of women who are prepping for delivery have cocaine use, which is interesting to be aware of. The increased risk of heart attack, stroke, and sudden death for the mother is increased when she uses this drug, and also low birth weight, spontaneous abortion and death, higher risk of preterm labor and delivery, and limb reduction in the infant is common. And on the next slide you'll see a picture of that right here, limb reduction. A study was done in which 8-year-olds were compared, 8-year-olds whose mothers had used cocaine while they were pregnant with them, were compared, and there were deficits in certain brain functions and brain cells, and these cells were used to allocate energy and function properly. So even after 8+ years of having been exposed to this drug, the consequences are still there. So neonatal abstinence syndrome is a variety of problems that can occur when the mother is exposed to addictive drugs while pregnant, and so you have your cocaine and your amphetamines as well as other drugs that are important. Here you see 2 babies experiencing this syndrome. Basically, this syndrome has the child experience withdrawal syndrome, so tremors, irritability. Interestingly enough, there's also an inability to suck, and this can hinder breastfeeding, which can eventually lead to malnourishment. The best way to handle this is for doctors to create a peaceful environment with little stimuli so the infants can calm down, and after 7 months there are no negative effects associated with this. So it's important to be aware of all the consequences and results of a mother using substances while she has a fetus inside of her. And here you can take a look at my bibliography. It's pretty long, so I've attached it below on WebCT in case you would like to look over it more. So 3 more slides. Thank you very much.